Hi, my name is Dallmann. I'm the Hunger Solutions Innovator at the Food Bank of Western Massachusetts, and we're excited to be working with Holyoke Community College this year. One of our most recent initiatives is the Coalition to End Hunger, and we work with the medical community, we work with the educational community, business community, work with clients themselves, all looking at what is it that we need to do so that there isn't such a need for food. That Coalition to End Hunger has several different components. One is a public awareness campaign, which Holyoke Community College is actually hosting a kickoff for that on September 10th here at the Kittredge Center. And that's really addressing stigma. Why is it that people don't use the services, and getting people to feel better about using the emergency food network, but also educating the public to show that food insecurity is real, that the numbers are high, etc. There's another group that works on public policy. But the third group, and that's the one that connects most to the Holyoke Community College and their community health worker program, and that is, it's called service integration. And that's really figuring out how do we work better with our partners to get people the services they need. And one thing that we're really interested in working with Holyoke Community College on is this idea of connecting food insecurity screenings that happen at a medical facility and connecting that to being able to refer people not only to the emergency food network, but to those services that can help address the root causes of hunger, many that are connected to poverty. We've started a program at the Holyoke Health Center where doctors will screen patients for food insecurity. They answer just a couple of questions before they go in for their visit, and if they show that they've either worried about food or actually have run out of money for food, they can be screened positive for food insecurity, and they have the option of being connected to the food bank through the doctor, through the medical assistants there. And we have an employee, a food bank employee at the Holyoke Health Center who can then kind of refer those patients to the pantries that are in Holyoke, the shelters if they need to, the meal sites, etc. But then they take it another step and they look at housing, they look at job training, they look at other health, smoking cessation classes, diabetes management. And this is where we think that we can have a good relationship with the community health worker program. We're looking at having a practicum student this fall who can kind of help us look at the program help us see it through the client's perspective, but also see it from their perspective, and actually help us in terms of identifying other partners for referrals and get some practice in connecting people that screen positive for food insecurity to the services that they need. So there are a lot of ways that students can be involved with the Food Bank of Western Massachusetts, many ways. One simple way is volunteering, if they have the time to volunteer. And volunteering in the food bank can mean many different things. It can be one-time helping with a large event that we do. It can be a regular volunteering at the warehouse in Hatfield where you kind of sort food. There's an after-hours program, so a way that people can work and volunteer in the evening there. But a big way that students can help is to kind of help us with sort of telling the story of food insecurity. So one way to help is to kind of share that story if you feel comfortable doing it. It can be challenging to be a student and possibly also a parent and getting food and getting everything that you need, etc. So that's an important way. Or letting people know about ways, letting your fellow students know about ways of accessing the emergency food network or all the services that are available there. Yeah, advice I'd have for students that are interested in community health work, especially with food insecurity, is just to kind of go out and see what's out there. So even if it's not visiting the food bank, which you're always welcome to do, and just to see what a food bank is and how it works, etc., especially the community meal programs. Instead of I think soup kitchen is the word that many people might think of, and so many programs are trying to change from a soup kitchen model to what's called a community meal. So there's no income guidelines on either direction. It's a meal, there's plenty of food, and if you're interested in that kind of work, there's ways of connecting with people that use social services without actually having to first be a provider per se. So that's some advice I would give.